In our social newscast, I focus on Community Keepers, who's an organization that partners with schools in under-resourced areas where they establish therapy rooms manned by professional counselors. I'm in conversation with CEO Gerrit Lanning about Mental Health Action Day and the partnerships they create to provide support for learners, educators, parents, and guardians. Gerrit, thank you very much for your time. How do you reflect on today as Mental Health Action Day?
Yeah, Sam, thank you so much. I think you put the emphasis on the right word, being action. And I think in mental health terms, there is this progression of thought where you start by knowing something, usually, understanding it, making it your own, then talking about it, and ultimately doing. And I think it's true for a whole bunch of things. And what we are of the opinion is that in mental health, history has shown us that there was a time when you didn't know, you didn't want to know, and it was so stigmatized that people were literally put on stakes. We've moved towards talking about it, and I think COVID-19 has given us a whole bunch of progress in that, is that now we talk about mental health because we all feel it. It's become real for us. And our next big step is to try and motivate people to say, let's action this. Let's say it's not about talking, it's not about thinking about mental health, it's about doing. It's about doing it for yourself. It's about seeing it in other people and helping them to look after their own mental health. And also then ultimately creating a system, an environment where mental health is being known, being talked about, which is always important in terms of awareness, but even more so is that we start looking after ourselves and promoting good mental health.
With that being said, Gerrit, one of the things that Community Keepers has done is that you've early on identified that mental health is not a singular silo action, that you have to partner. Who have you partnered with and how have you developed those partnerships to say that this is who we are from a methodology perspective and this is the kind of partners that we want to attract?
Yes. So on a strategic level, obviously because we work in schools and our major constituents or our major clients are our learners, we've got a very good relationship with the education department, which is very important. We also have very strong relationships with the schools as individual schools. And by default, it becomes then our entry point into community because you cannot offer a service, you cannot offer support if it is not being asked for, is our belief. On a broader scale, on a more organizational scale, we do partner with like-minded organizations, and that is about as broad as it goes. So we try and align ourselves to everybody who has got a heart for specifically young people, in our case, who are trying to promote the well-being, the subjective well-being of young people. And in that way, we actually partner with a diverse range of services, initiatives, and obviously also trying then to focus on like-minded organizations who work in the psychosocial development sphere.
A little bit earlier, before we started the formal part of this conversation, you talked about the second pandemic and the catastrophic nature of the second pandemic, and that sometimes because the actual pandemic is constantly top of mind, it is in the media space, that there are elements of the second pandemic that's actually falling through the cracks. How, as an organization, are you dealing with the second pandemic?
So yes, the second pandemic, as you said, is there. It's real. It's grown in exactly the same lines as what the first one or what the initial real infection caused us. So I believe that ultimately COVID-19 from a psychosocial perspective is a trauma, and it's about people's ability to handle trauma. And of course, if the extent of a trauma becomes prolonged or it becomes too intensive, then people cannot handle it anymore. And I think most of us, if not all of us, have gotten to a point where at some stage, in some ways, we started feeling this is becoming overwhelming. And even more so for people with less resources, less support. And I'm thinking specifically of our learners. And in that way, that is where we are at. We're at a point where a trauma has become overwhelming. And the next logical step, and we see it in research, we see it anecdotally in our own statistics, is that the increase of anxiety, the increase of depressive mood disorders, and then in general, people starting to have a very, very low or negative outlook, and sadly, in some cases, actually resulting in suicidal ideation, thoughts, and unfortunately also sometimes action.
You're quoted as saying, Gerrit, that taking care of your mental health is no different to taking care of your physical health. Just what does that mean for the layman on the street?
Mm-hmm. So I think most of us will not willingly neglect our own physical health. I think most of us will look at physical health and will say, I am not going to walk in front of a car on purpose because I'll get hurt. And the unfortunate with mental health is that it's not always as obvious, but it is as dire. And that's why we try and promote exactly what I said previously in terms of knowing, talking, and actually actioning, is that the more we become aware of mental health as an integral part of our humanness. We're talking about what's going on in our head. And I think most of us will agree that our heads kind of governs us. So if I am not okay in my head space, everything else are not going to be okay. And that's the part where we need to acknowledge. We need to say that this is very important. It's as important, if not perhaps even more important, than our physical health. And ultimately, then that awareness can get us to a point of starting to look after ourselves.
Have you seen a willingness from teachers, learners, parents to engage with the ideas around mental health awareness or just mental health in general? And then also, who have you partnered with from a community keepers perspective?
So absolutely, yes. The answer is yes. And I think it's not so much, we do awareness drives, we do sensitization drives. I think where it becomes more pertinent is where people see the benefits of a psychosocial intervention on a practical level. So it's when a teacher sees the difference in a learner, or when a learner sees the difference in a learner, and they start asking the question, so why is it that this person is now different or acting differently, or even just attitudinally, for starters, different? That then opens the door to say that this aspect of humanness, first of all, is super normal, and it is actually normal not to be well often, but it is as normal to actually work on it. And then mental health becomes normal. And when mental health becomes normal, you can actually just go forward and everybody accesses the service, and the whole system becomes one of being engaged and motivating towards the mental health aspect of humanness. Partnering with question, yes, we do in our schools contexts. We deliver a lot of the services ourselves. A lot of expertise are within our organization, and yet we do realize that the extent of the need often is huge. One example, for instance, is where we've realized that career guidance sounds like a very small thing, but it's actually a huge need. And once you've helped a learner to establish a passion or a direction for their lives, that becomes part of the drive towards, or sometimes away from initially, but then towards something better, towards an increased well-being. And in that regard, we have got this partner called Yenza, who has got an online platform, career guidance, brilliant material. And we just partnered with them because we said that for us to go and develop or try and redevelop that wheel is ludicrous. They are specialists in the field, and it works. So that's kind of our intention also, our approach also is to always look for partners that can either enhance our services with a specialist approach or that are peripherally linked to us. We also work with networks. We are involved in a number of networks, professional networks, supportive networks, networks that are linked just via the NGO world. And yeah, that becomes the partners that adds value to our services, that also supports us, and that ultimately start creating a comprehensive approach into communities where you're not working in silo, but that you're actually working collectively towards one goal.